Hi, I'm Zubair Qureshi. I'm the undergraduate tutor at Mid Cheshire Hospital's NHS Foundation Trust. We look after medical students from Manchester Medical School for their year 3, 4 and 5. And they come here and they have wonderful experience. Here are few students talking about their experiences.
The best thing about obs-gynae placement in year 4 is that you get to go on many wards, and there's loads of consultants who are in obs-gynae specialty at Leighton Hospital. So you get loads of teaching, and you get a labour week as well, where you get to see loads of babies being born, which is kind of a life-changing experience in itself.
It's been a really great placement, and everybody here is really friendly and happy to have you as part of the team, and it lets you get real hands-on experience as to what being a junior doctor's like, and you get to take part in all the jobs, take part in the ward rounds, see patients, and just kind of get used to what being a doctor will be like in the future.
I've been placed in Leighton for the last 7 weeks during the end of my HLB module. I've been on the respiratory wards, and it's been really good. I've got to experience all sides of medicine, including going to MDTs, going to clinics, being on the wards, and just some fantastic teaching here in the hospital.
So I'm on an NME placement at the moment, and I'm in surgery with a lower GI surgeon, and it's been really good. He's a really enthusiastic teacher, so as well as spending obviously time with his patients, he's really interested in getting us involved in every aspect of what he does. So when we've been to consent patients, he's consented them, and then we've had a discussion about it, and we've examined the patient, and we've formed all of this aspect of it before then going to theatre and watching the operation take place. In the operation, he's really keen to get us involved, so we've scrubbed up a lot. We've been able to stitch, and in fact we've learned to stitch because we weren't able to stitch before the placement started. Now, well, for a medical student, I'm quite competent, I guess.
I actually found it quite easy to meet my objectives, especially compared to my other placements, because there's a lot of staff around and not as many students, obviously, so it's easy to go find people and ask if you can do a certain thing to get it done.
In terms of meeting our objectives, I think it's been just about right. We've been kept reasonably busy, but that's in a good way. The timetable has been very good, and we've had plenty of teaching. So our objectives have been to spend a certain number of hours or sessions on the wards each week in a clinical setting, and have a certain amount of teaching as well. It has been a challenge at times with the bank holidays, but we've managed to fit just about everything in, and the staff have been very helpful in supporting us through this as well.
I think it's been fairly okay to meet the minimum standards that are set out by the university. Everything has been sort of timetabled in for us. We've been made sure we've been informed of different clinical settings and environments which we can attend. So overall, I think it's been fairly good.
To meet the minimum standards, it's been quite easy in terms of taking the 3 histories and presenting each week. And obviously, because we're on site, being in a clinical setting for the 4 sessions has also been fine, and it's been quite varied in what those clinical settings are, but it hasn't been a problem at all.
So the teaching's of really good quality. There's a lot that's already arranged, but everyone's willing. If you want more, you can just arrange what you want, and they'll teach basically what you need to know, what you want to know. But there's a lot already arranged for you. It depends entirely on what you want.
The quality of teaching has been absolutely fantastic, and that's one of the aspects of being at Leighton Hospital that I think myself and all of my colleagues have enjoyed the most. Normally in medical school you get sporadic teaching in a good way. You get to experience many different clinicians and consultants across loads of different wards, but it can be sometimes difficult to knit that all together, and to overcome this we've had an ST1 education fellow allocated specifically for us. So it's been very nice to have one clinician dedicated just to us week in, week out, and then on top of that to have the normal ward teaching on top. So it's been a really good experience.
The teaching here in Leighton is second to none. It is absolutely fantastic. I wish we had it in Liverpool, to be honest. I can't stress how amazing it's been, just being able to have so much contact time with our tutors and be able to express our opinions and thoughts on certain things, and then not only to have teaching, i.e. in the lectures, but also to be taken onto the ward with our teaching, and then to incorporate, you know, the bookwork with real patients. That's been fantastic, and I've learned so much from it.
Oh, the quality of teaching, that's fantastic here. It's amazing. They really break things down for you, and I really like how the doctors actually tells you the way they think, so you learn to you understand that when you understand the thought process, you understand the reasons behind things, and it makes things so much easier. So I really like that.
Well, we've had a lot of support while we've been at Leighton Hospital, both by the undergraduate team and by the consultants. On the first day when you get here, the consultant will meet you and the undergraduate team meets you as well and shows you around the hospital. As well as that, they continue to support you throughout the whole 7 weeks that you're here. And any problems that you have, you can go to the undergraduate team.
The support has been really good. Everyone's really friendly, everyone's willing to help. The postgrad team have been really good, and everyone on the ward's been really helpful and really keen to help me with anything that I needed.
When at Crewe, when we started, we met everyone. We had a really good induction. We had someone who we could go to organise the placement. We also had your consultant comes to speak to you, go through everything you need to do. We went round and met everyone, so I thought that was really good. On the first day, so we went to every department, they had photos of us, so when you went up you didn't feel like you were nobody. They said, oh, I've recognised your photo and things, so you did already feel part of the team.
In terms of support and feeling welcome, I have to give a big thumbs up to Leighton Hospital. We have a postgraduate centre over here for the students, and well, we do get lots of free tea and coffee, I can tell you that much, and biscuits. But on a serious note, we are very, very well looked after. The staff are very approachable. If we have any problems, any issues, any concerns, be it academically or even personal, the staff are very understanding and supportive. And if there's something that they can't help us with, they're always happy to point us in the right direction. And I'm not saying that just to be overly polite, I can say that from my own experience as well. The staff genuinely are very supportive here. So a big thumbs up.
Oh, the support has been really good here. From the very beginning, the admin staff has been very welcoming and has told us that if you need any help, just come and talk to us. And throughout this placement, they've proven it as well. And we've got our education fellow and also clinical intelligence tutor who's always asked us what's wrong, if there's anything wrong, do you need any help, is there anything else that you would like us to teach you? So which was very good.
It's been very easy to meet my supervisor while I'm here, especially if they can give you their own number and you can call them as well. And you can also meet them on specific wards, and they give you teaching as well every week, which is great as well because you get to know them.
I have found it very easy to speak to my supervisor. He is on the wards a lot, and whilst he's there, he's very happy to have me involved and to speak to me. He's also scheduled one session a week for an hour each week, just to check up on how we're doing and what we want to get out of that week and what we plan for the next week. So yes, it's been very easy to access my supervisor.
The clinical skills teaching that we've had has been really good. Because there's less students, it means that we have more hands-on experience and more time to ourselves to practice.
The clinical skills teaching here at Leighton is very good because it's quite widespread. You get a lot of teaching from different specialities, and there's always teaching every week and available whenever you want.
Yeah. Clinical skills is actually something I was concerned about, given that this is the semester before my OSCE. However, it's been fantastic. We've had so much opportunity to come to the lab here. We only share it between about 14 of us. And whereas if we were in Wythenshawe, we'd have to compete with the whole year group. So it's really good in that regard. You know.
The clinical skills teaching here at Leighton has been really good. We have a dedicated clinical skills lab, which you can see we're in right now, and the tutor is very, very approachable. If the lab is ever closed in the middle of the day, all we have to do is ring in and it will be opened up for us, just so we can slip in some extra practice. This has been really helpful considering our OSCE exams are coming up. If there's any equipment that isn't out at the time, all we need to do is ask the tutor and he's more than happy to have it put up for us. So all in all, it's been a very, very good experience with plenty of opportunities to practice.
The library's been very good and very supportive because you can come in whenever you want, and you can also get a card which allows you 24-hour access. As well as that, you can get a wide range of medical books which can help you with your study.
The library's been pretty good actually. I've been able to get every book that I've needed. I've not had to haul all my books up here from Manchester. And I've actually used it for some late night study sessions with my access card. And it's just a nice quiet place to go and do some private study really. Yeah.
I found the library very useful. I took membership at the beginning of the time we were here on the first day, and I would very much recommend people do that. They have an online reservation system which you can join as well, which means you can renew books that you've taken out online, which saves you having to keep going to the library to renew the books.
The accommodation here at Leighton is great because it's close to the hospital, and you can get out of bed at 8:30 for a 9 o'clock start, and you can go back for lunch. As well as that, for me, I found that you can do on-call shifts a lot easier because you can not worry about coming back too late because you're right next to the hospital, so it's less dangerous.
The accommodation's good, it's got good facilities, and it's like being back in halls again. There's a few of you here and you get sort of good camaraderie going on, and it's good fun.
The accommodation's really nice actually. It's basic but it's got everything you'd want. It's clean, you get a cleaner, there's fresh bedding and towels, everything like that if you need it. You don't have to bring anything if you don't want to. And it's really close to the hospital, so you can have a lie-in, which is nice.
I would recommend another student come into Leighton, purely because there's not a lot of students here, so the amount of exposure you get to different varieties of medicine are vast, and you get to practice a lot of things that you might not be able to do so in a larger hospital.
I definitely would recommend Leighton. I think it's really good because you've got a week, you're here in the week, you can get all your work done, there's really good resources, really good support, go on the wards, get it all done, and then when you go home on the weekend, you can have a nice relaxing weekend. But I think for me, the first thing I'd say is as soon as you start, get in your PBL group, get knowing everyone, organise things to do. There's so much things you can do around and really socialise, because without that I think you might feel a little bit lonely, but if you do that I think it's a really good placement.
I think I would recommend coming to Leighton. It's a very different experience from being at one of the big base hospitals. I find there's more teaching available, more of small group basis, which is always going to be helpful, get more time spent on you. So I would recommend it.
If you're thinking of coming to Leighton, I would say come with an open mind and you might find something that you really, really enjoy. Leighton Hospital has a lot to offer, the staff have a lot to offer, and honestly the teaching over here has been absolutely fantastic. I must say I've learned a great deal whilst being here, and I've really enjoyed it. I mean, this is my last week and I honestly couldn't tell you where the time has gone. So I would say just come here and just get stuck in, you'll enjoy it.
I think the best thing about being at Leighton is the staff. Everybody's really happy to have you, the undergraduate team and everybody on all the wards. I've had 4 placements here over the last year and every single one of them has been really good, and in all of them I've been integrated into the team and made to feel welcome and been able to sort of just learn a lot and get on with doing the job of what we're going to be doing in August.
I think the best thing about being at Leighton is the staff. Everyone's really friendly, everyone's really keen to have you, even if you just show up to random different clinics and things, everyone's always really willing to have you. And also living on site I think is really useful. I did an A&E placement here and it was so much better because I could go to night shifts and come and dip in and out when it was busy and when it wasn't busy. So it was really useful.
I think for me the best thing about being at Leighton is the fact that you're so close to the hospital. It's a small hospital, so you are part of a team, so you really can get involved. I mean, I've self-arranged to come back from SSC now because I enjoyed it so much and the team made me feel so welcome.
The best thing about being at Leighton, I can't actually pinpoint on a particular thing. The teaching has been good. The people, the fact that I got to bond with the people who I came with was good. And the staff was lovely as well. So I would say 3. I can't really say what's best. So yeah, the 3 things, the staff here, the teaching, and the people who I got to bond with, that would be my 3 thoughts.
The best thing about being at Leighton, I couldn't pick just one. There are so many positives about being here. All the staff are very approachable, from the clinicians right through to the postgraduate staff. The facilities are very good, the teaching has been very good, and the area is very nice. I mean, we've been here in wonderful weather, there's been plenty of wonderful opportunities to go walking. I don't know about everybody else, but I love walking, and the fields over here, the countryside, it's been a really, really nice change and a wonderful experience. So all in all, I think it's been good.
Our consultant is probably the most popular consultant in the hospital, and it's very glamorous going around with him because everyone is very keen to talk to him and finds him a really nice chap. So I think that was actually the best thing because it got us in a lot of places we might otherwise not have been. So.